NCLEX RN, Next Generation Format, actual exam with complete 500 questions and correct detailed answers with rationales, verified answers. Question 1. Several residents in a rural community report recurring headaches, nausea, and dizziness after drinking and cooking with water from private wells. Some families also note a metallic taste and unusual odor in the water. As part of the public health response team, which action should the community health nurse take? Advise residents to temporarily use bottled water for drinking and food preparation. 2. Record the complaints and submit a report to the local health department. 3. Recommend over-the-counter medications to relieve reported symptoms. 4. Arrange for immediate collection and laboratory testing of well water samples. Question 2. A community health nurse is assessing the effectiveness of a year-long childhood obesity prevention program that includes nutrition education, physical activity sessions, and family counseling. Several types of data have been collected during and after program implementation, which finding indicates that the program has achieved its primary health objective: an increase in the number of educational materials distributed to families. 2. Consistently high attendance rates at exercise and nutrition sessions. 3. A sustained decrease in participants' BMI for age percentiles. 4. Positive feedback scores on post-program satisfaction surveys. Question 3. A community health nurse plans and implements tuberculosis screening, vaccination referral, and hygiene education programs for individuals living in a highly crowded and secured environment. The nurse also collaborates with security staff to manage infection control and outbreak prevention. In which practice setting is this nurse likely employed? Government Public Health Agency. 2. Home Health Agency. 3. School Health Services. 4. INL Facility. Question 4. A community health nurse is working with families living in older housing where children have been diagnosed with elevated blood lead levels. Which interventions should the nurse recommend to help lessen ongoing lead exposure in children? Arrange professional inspection and removal of peeling lead-based paint. 2. Provide routine vitamin C supplements to all children. 3. Encourage frequent handwashing only, without home modifications. 4. Teach families to use wet mopping and damp dusting techniques. 5. Question 5. During a scheduled home visit, a community health nurse is assessing multiple family members who report different health concerns. While gathering information, the nurse learns that one child may have swallowed an unknown household substance earlier in the day. Which family member should the nurse assess? A toddler who was found playing near household cleaning supplies earlier in the day. 2. A father experiencing chronic lower back pain for several months. 3. A grandmother with well-controlled type 2 diabetes. 4. A mother who reports ongoing fatigue and has been diagnosed with mild anemia. Question 6. A community health nurse works in a social service agency that serves individuals and families experiencing homelessness, food insecurity, and limited access to healthcare. Which nursing activities are consistent with practice in this setting? Performing complex wound care for hospitalized patients. 2. Monitoring workplace safety and occupational hazards. 3. Providing emergency trauma care in critical care units. 4. Connecting families with free or low-cost health clinics. Select all that apply. 5. Question 7. A public health nurse employed by a state health department is reviewing data from a 3-year maternal health initiative designed to reduce pregnancy-related complications in underserved communities. The nurse must recommend whether the program should receive continued federal funding. Which outcome is appropriate for determining the program's effectiveness? Percentage increase in prenatal class attendance. 2. Improvement in staff performance evaluations. 3. Decrease in pregnancy-related deaths and severe complications. 4. Number of community partnerships established. Question 8. A public health nurse employed by a state health department is assigned to the Emergency Preparedness Committee responsible for revising statewide disaster response procedures. The committee's goal is to improve coordination and efficiency during large-scale emergencies. Which action by the nurse demonstrates leadership in emergency preparedness? Developing and facilitating multi-agency disaster simulation exercises. 2. Providing first aid and triage during emergency operations. 3. Managing the distribution of emergency supply kits. 4. Collecting and submitting post-disaster injury data. Question 9. A community health nurse is providing outreach at a homeless shelter. A client declines tuberculosis, TB, screening, expressing fear of stigma, potential loss of housing, and distrust of healthcare providers. Which community health nursing, CHN, principle should guide the nurse's response? Exercising professional authority to insist on screening. 2. Involving client in care decisions. 3. Enforcing mandatory compliance with public health regulations. 4. Prioritizing disease surveillance and reporting. Question 10. A public health nurse is participating in a community disaster management planning committee. The team is reviewing strategies aimed at decreasing the long-term impact of floods and other natural disasters before they occur. Which action represents disaster preparedness rather than disaster mitigation? Developing and updating flood zone hazard maps. 2. Constructing levees and flood barriers in high-risk areas. 3. Establishing and equipping emergency shelters for displaced residents. 4. Implementing land use regulations to limit construction in flood-prone zones. Question 11. A community health nurse is analyzing factors that contribute to health disparities in a low-income urban neighborhood. Which of the following are considered social determinants of health that influence population health outcomes? Housing quality. 2. Personal motivation. 3. Access to education and literacy programs. 4. Genetic predisposition to disease. 5. Question 12. A community health nurse is conducting a school-based oral health assessment in a rural area and notices a high prevalence of untreated dental caries among children. Which intervention represents primary prevention for dental disease? Applying fluoride varnish and providing oral hygiene education in schools. 2. Restoring decayed teeth with fillings. 3. Performing extractions of severely decayed teeth. 4. Applying sealants only to teeth with early decay. Question 13. During a home visit, a community health nurse observes that an elderly client with limited mobility lives in a cluttered home with loose rugs, poor lighting, and obstructed walkways. Which intervention addresses a social determinant of health to minimize the client's risk of injury? Providing an educational pamphlet on fall prevention strategies. 2. Referring the client for home modifications and occupational therapy. 3. Advising the client to perform daily balance and strength exercises. 4. Scheduling frequent home visits to monitor vital signs. Question 14. A community health nurse observes that a neighborhood near a busy highway has a high incidence of pediatric asthma exacerbations. Which intervention would effectively address the social determinant of health contributing to these respiratory problems? Teaching families proper inhaler technique and asthma management. 2. Distributing educational materials about asthma triggers and symptom recognition. 3. Advocating for local policies to reduce traffic pollution and improve air quality. 4. Referring children to pediatric pulmonologists for specialty care. 5. Question 15. A community health nurse is planning a local immunization campaign in a culturally diverse neighborhood. Which strategy demonstrates client participation in community health nursing? Nurses designing the vaccination schedule without community input. 2. Establishing a community advisory board that includes residents to guide program planning. 3. Requiring all community members to attend health education sessions. 4. Distributing standardized health brochures without discussion. Question 16. During a home visit, a nurse observes that a mother is giving her child a traditional herbal remedy that may interact with the prescribed medication. Which action demonstrates culturally competent care while promoting patient safety? Instruct the mother to immediately stop all traditional remedies. 2. Allow the mother to continue the remedy without discussion. 3. Report the mother to Child Protective Services for noncompliance. 4. Educate the mother on potential interactions and collaboratively discuss safe use while respecting cultural practices. Question 17. A community health nurse observes that prenatal care attendance is consistently low among pregnant women in a rural area. Which action should the nurse take to address this issue effectively? Conduct a comprehensive community needs assessment to identify barriers. 2. Distribute educational flyers about the importance of prenatal visits. 3. Provide one-on-one counseling to pregnant women who attend the clinic. 4. Wait for women to voluntarily seek care at the clinic. Question 18. A community health nurse is developing a disaster preparedness plan for a hurricane-prone coastal town. Which interventions represent primary prevention? Conducting community education on evacuation routes and emergency procedures. 2. Providing first aid training to residents. 3. Organizing routine care for residents with chronic illnesses. 4. Stockpiling emergency medications for individuals with existing conditions. Select all that apply. 5. Question 19. During a confirmed measles outbreak, a parent declines the measles mumps rubella (MMR) vaccine for a school-aged child, citing personal beliefs. State regulations require proof of immunization or an approved exemption for school attendance during outbreaks. What is the nurse's action? Enforce school exclusion per state outbreak regulations. 2. Permit attendance with daily symptom monitoring. 3. Report refusal immediately as medical neglect. 4. Administer vaccine under emergency implied consent. Question 20. A community health nurse is planning a mobile clinic for a remote, culturally diverse community with limited healthcare access. Preliminary assessment reveals the following challenges: unreliable public transportation, varying work schedules, multiple languages spoken, and limited health literacy. To maximize participation and access, which barrier should be addressed? Developing culturally appropriate community health educational materials. 2. Hiring multilingual healthcare staff to facilitate communication. 3. Securing reliable client transportation for mobile clinics. 4. Scheduling clinic service hours around work schedules. Question 21. A community health nurse is implementing a vaccination and chronic disease outreach program in a culturally diverse, low-income neighborhood. The nurse aims to uphold ethical and legal standards while improving participation and health outcomes. Which actions demonstrate adherence to ethical principles in community health nursing? 5. Prioritizing vaccine distribution based on objective risk criteria. 2. Simplifying explanations by omitting rare but serious risks. 3. Securing private spaces for confidential health screenings. 4. Scheduling outreach events only during standard business hours. Question 22. A public health nurse working in a rural county observes a significant increase in opioid-related overdose deaths over the past 6 months. Community members report limited access to emergency services and long transport times to the nearest hospital. Which intervention should the nurse prioritize to decrease mortality in this population? Develop and distribute opioid safety and prevention educational flyers. 2. Implement a community-wide naloxone distribution and training program. 3. Organize weekly substance use counseling and support sessions. 4. Extend operating hours at local primary care clinics. Question 23. A public health nurse is conducting environmental safety inspections in community facilities and residential buildings. During one assessment, several hazards are identified. Which finding requires the immediate intervention to prevent serious long-term health consequences? Peeling paint observed in an elementary school classroom. 2. Visible mold growth in a public library reading area. 3. Elevated radon levels detected in basement-level homes. 4. Deteriorating asbestos-containing materials in public housing units.